Have you been able to talk with anybody, any of the people that you were working with during that time period, or even now?
You know what? Not really. No one wants to talk about it. And honestly, I don't blame them. I think what we try to do is like carry on, like nothing happened. Like, this is just part of a job. It's life. We continue forward. No big deal. But I think that people need to start coming forward in healthcare and talking about this, because our mental health matters too. I have a therapist, and it's been like her hammering me every week to get me to talk about it. Sometimes I can say little things like I've said to you today, and other times I can't say anything and we just stare at each other. So it's like, it takes time. It doesn't happen overnight. But this is the first time I actually shared my story in depth. And it's very freeing, but I can say on a lighter note that sharing our stories with other healthcare providers and doctors and nurses, everybody, it's very healing, because we're not alone anymore, like we felt when we would come home. And I think that's the biggest thing I want to get across is I don't want anyone to be afraid to share their story about working COVID, and that you're not crazy, and that it's okay to cry about it. It's okay to love patients so hard that when they pass away, you're upset too. That's allowed. Should never not be allowed, because we love them too.
And because we're humans and we're surrounded by so much suffering. Like, we're not robots.
No. And I don't know why people think that we are, because it's like we're expected to like show up, we're ready to handle the day. No matter what it is, you'll be fine. But it's like, you and I are not robots. We have very powerful, vibrant, loving souls. Even though we contain ourselves in the moment, when a patient passes away or things are bad, when we go home, it's like you fall apart. You just do. But I think falling apart's okay sometimes, because then you get to put yourself back together and start over.
I think it's important to be able to have a place and a space to release.
Absolutely. And I want to get to a point, I feel like in healthcare, where people can take 10 minutes to regroup for their mental health, no matter what. And that means everyone, from top to bottom, every single person who sets foot in that hospital needs 10 minutes to breathe. And I don't know why we as a society right now don't think that's okay.
For us, by us, and just for us, this is hope for med.